This is Ashley Walker reporting for Tracy Pearson. She will be performing wound care.
So the first thing I'm going to do is I'm going to check the physician orders, looking for any topical agents that we may use along with any dressings or bandages that I'm going to be using for this procedure. Then I'm going to gather my supplies, which I already have done. I have everything from normal saline to my measuring, my disposable measuring tape, my bandages, my tape, my Sharpie, my calcium alginate, and my sterile cotton tips. Good morning. My name is Tracy. I'm going to be your nurse this morning. Can you tell me your full name and date of birth? Perfect. I came in this morning because I need to change the dressing on your wound and reassess that. Is this a good time for you? It is. Okay. The first thing I want to know is, do you have any allergies to any topical agents or latex allergies that I should be aware of? You don't? Okay, good. I'll take a look in your chart as well. Now, how are we doing as far as pain? No pain. Do you feel like maybe we should get something on board prior to beginning this? You don't. If my patient felt the need for pain meds, I would make sure that I go and get those at this time, making sure that I looked at the peak effect. If it was 30 minutes, then I would allow the medication to work, come back in 30 minutes, reassess. If the comfort level was good, then I would go ahead and perform wound care. So I am going to just go ahead and pull the curtain. I'm going to wash my hands and I'm going to apply gloves. Okay, Mr. Pearson, the first thing I need to do is I need to turn you over on your stomach into a prone position. I'm going to keep you covered and as comfortable as I possibly can, okay? So I'm going to turn my patient over into a prone position. I've got these nice warm bath blankets we're going to put on you. I'm going to make sure seams are up and that my patient is covered. Covering the bottom half, only leaving the area of the wound exposed. I want to go ahead and put my bag here. Now I'm going to take off the dressing. At any time you're uncomfortable, don't hesitate to let me know, okay? Okay, so I'm looking at the AVD pad. I would say I have a small amount of sanguinous dressing, exudate, I mean, and I have a moderate amount of sanguinous on the 4x4 AVD pads. I'm going to remove my gloves. I'm going to wash my hands, and I'm going to apply new gloves. So I have a midline sacral wound. This would be a stage 4, and I can tell that because it's at full thickness, and I can see bone is exposed here. So let me get my little... First thing I'm going to do is just measure this wound, okay? Maybe. Okay. So we have the length of the width, or the length of the wound is measuring 10 centimeters. I have the width, 8 centimeters. And I'm going to go to the deepest part. And for depth, I have 3 centimeters. I have undermining, it looks like from 10 to 2. Undermining at 10 o'clock is 2 centimeters. Undermining at 12 o'clock is 2 centimeters. And undermining at 2 o'clock is 1.5 centimeters. Also making note that I have tunneling here at 7 o'clock. And undermining is measuring at, or the tunneling is measuring at 4 centimeters. I have 60% granulated tissue, I have 30% slough, and I have 10% bone. The area around this wound is, it looks good, other than at 5 o'clock I have some necrotic tissue, which is unstageable. The edges of the wound, they're a little jagged at 9 o'clock and 12 o'clock, and a tad bit here at 3 o'clock. There is no exudate in the wound, however, if there was, I would take note of the color, the amount, and the odor. At this time, I would cleanse the wound using normal saline, or I would use a prescribed wound cleansing agent. I would clean from least contaminated to most contaminated, and I would gently wash and dry the peri-wound area. Remove my gloves, I would perform hand hygiene. At this time, if there was a topical agent that was prescribed, I would apply that. I would make sure that I have gloved hands, and if prescribed, I would use a cotton-tipped applicator or a gauze to apply the topical agent. Okay, so I think we are ready to get started. Get my sterile gloves. Go ahead. Keep my eye on my sterile field here. Getting your gloves. Okay. Okay. I am ready to get my calcium alginate, so I'm going to have my partner come around and hold this for me. And I know that I would never pack this. Actually, I'm just going to. Oh. I am going to. Put on new gloves here. And I have my partner hold the calcium alginate again. This is not my sterile field. This is my sterile field. Okay. Okay, so now we're ready to pack the wound. I'm going to dispose of that in the garbage. I'll put my 4x4 gauze over top. Oh. I would make sure that I had another roll of tape here at the bedside. I'm going to tape this side as well as this side. I'm going to initial it, date it, 11/17 and 09/30. I am going to clean up my supplies, get rid of all of my soiled stuff here. I would put these in the proper location. And to get rid of everything, I'm going to remove my gloves. I'm going to perform hand hygiene and put on a new pair of gloves. Mr. Pearson, how are you doing with pain? You're still okay? I'm going to reposition you on your side. Would you like to be on your right side or your left side? Right side. Okay. So now I'm going to reposition my patient off of their buttocks area onto their side. I am going to make sure I put the bed in the lowest position, that they have their call light. Anything that they may need is well within reach. I am going to remove my gloves and document the procedure.